Hello, this is Dr. Nithya Ramachandran, consultant obstetrician and gynecologist. September is a month of PCOS awareness. So, what do we mean by creating awareness about PCOS? Polycystic ovarian syndrome is one of the most underdiagnosed disease in the world. Approximately only about 25% of women get detected with polycystic ovarian syndrome. So today I am going to tell you some myths and facts about polycystic ovarian disease or a syndrome. So what is this polycystic ovaries? See, every month during a menstrual cycle, a woman when she gets her periods, just 14 days before that, a dominant follicle or an egg will get ruptured from the ovary and it comes through the tube into the uterus. Now in women with polycystic ovarian syndrome, this does not happen every month. So what happens to the egg which is there in the ovaries? It gets collected as immature tiny eggs. That is what we call as multiple ovarian cyst. Now all women with polycystic ovaries will not be symptomatic. So what I mean by this? See, a woman can have polycystic ovarian syndrome from the age of 15 to 44 years. That is when it is, we call it as a reproductive age group. We know that a menstrual cycle should be between 25 to 35 day cycle and she can have period bleeding from about 5 to 7 days. In polycystic ovaries, exactly what happens? Because the woman is not ovulating at the right time when she has to, she is going to have a lot of menstrual problems. So let us talk about symptoms of polycystic ovaries. So number one symptom of polycystic ovaries is going to be irregular cycles. So what do we mean by irregular cycles? Instead of having period every month, she might be getting period for once in 2 months or once in 4 months also. There's going to be this long gap in her periods. Number two, during this periods, it may be either scanty periods, that is she is not having bleeding at all, or it can be excessive periods. Because for 2 months she is not having bleeding, so suddenly the day she bleeds, it is going to be excessive. Some women do bleed for more than 20 to 21 days continuously. Next, she can have pain during her periods. There are a lot of mood swings which are associated with polycystic ovarian syndrome or polycystic ovarian disease. Now, what could be the other symptoms other than her cycles? She can have, you would have seen a lot of these youngsters who are having irregular cycles presenting with acne. Now, acne or oily skin or what we call in common language as pimples, it is very common in college-going girls or in teenage girls per se. This can be a skin problem alone, but it can be more associated with polycystic ovarian disease. So, this acne can happen. The next thing that we most often come across is hyperpigmentation. Now, what do I mean by this hyperpigmentation? There will be a lot of dark patches that the woman finds in her neck. This is the most common area where the skin becomes very dark. This can happen under her breast or in the axillary area also, that is in her underarms. So all these problems can happen. The next thing what the women will have is there is excessive growth of hair on the face. So repeatedly they'll be going for threading, waxing and to the beauty parlor. And nowadays laser have come which have made the job much easier. This is what is called as hirsutism, that means excessive male type of growth of hair. So these are the common symptoms of polycystic ovarian syndrome. The next thing, you would have seen polycystic ovarian girls little bit fat or on the obese side or overweight. Now whether polycystic ovarian syndrome leads to obesity or obesity leads to polycystic ovarian syndrome, we don't know. Exactly, we don't know why this is happening, but these women have very much difficulty in losing weight. They try a lot of diet, exercise and everything, but still they are not able to lose weight. So these are the hormonal imbalance that is happening in women with polycystic ovarian syndrome and these are the symptoms.